But the White House is pushing to increase access. Starting Wednesday, you'll be able to request free rapid antigen tests at covidtest.gov, 4 per household. Experts say it's time to double down on what we know works.
That's why we want everyone to get vaccinated, to get boosted as soon as they can.
I'm Britt Conway reporting.
And here with us to provide insight on the gravity of the Omicron variant, we have Dr. Adam Brown. He's an emergency physician, also the chair of the COVID-19 National Task Force. Dr. Brown, always a pleasure, sir, having you on BNC Live. You are a friend of the show. So let's just jump right into it, right? Yeah, no, thank you. Let's talk about health equity when it comes to COVID. And now we're dealing with Omicron, which is highly transmissible. What are you seeing on the ground?
Yeah, so that's a really good point to bring up here because we're seeing a dissimilar outcome that's happening in various communities, especially in communities of color. And some of this can be traced back to access to healthcare, but also to access to vaccines, vaccination sites, testing sites, et cetera. I have to say, I live here in Washington, D.C., and I applaud Mayor Bowser for some of the things that she has done to specifically target communities where health access has been challenging, as well as access to vaccines and testing has been challenging, by removing barriers to allow more people to get access to healthcare, to testing, and to vaccination. And so just like with Omicron, and just like with other diseases, there certainly is a divide that occurs here in the United States, depending on the color of your skin. And a lot of that is due to access and a host of other issues, which we don't have enough time to talk about today, but a host of other issues.
Does it also matter where you live, the type of care you receive?
Absolutely. There's been numerous studies that have been done over the past few decades looking at the zip code that you live in tends to dictate the type of healthcare that you get. I remember Barack Obama making a comment one time about the zip code where you lived dictating the type of education that you would get. And that's very similar in healthcare as well. And so we need to do everything we can as healthcare professionals to remove those barriers, but also identify where those disparities exist and try to address those disparities. Because if they are there, we're not doing a service to our patients. And that's one of the greatest injustices that is there, is a healthcare disparity that should not be existing.
Yeah, absolutely. Dr. Brown, let's talk about clinician wellness, right? The CDC reversing course, cutting quarantine time down to half, among other things. We know, well, you know better than anyone, burnout is real, right? Can you discuss clinician wellness with us? How are you keeping everybody safe during this tough time?
Sure. This is a really challenging time, as we've been talking about. I think one of the challenges here is that Omicron has been a 1-2 punch. And as Dr. Megan Rainey was saying earlier, is we've not been able to rebuild after the flood. But what I think people forget to recognize is that there was a wellness or a flood of burnout that was occurring even before COVID-19. And a lot of that is due to the moral injury that occurs to a lot of our clinicians when they're working short-staffed or having a lot of the demands that may be put on them that's well beyond what were their expectations. I know working as a clinician, having to take care of patients when sometimes the resources may not be available is really challenging and also does over time start to cause some psychological harm. So for me, one of the things that I've been doing with a lot of my clinicians is taking a multi-pronged strategy of not only addressing some of the things that we can address operationally within the hospital setting, but also making sure that we talk very openly about the need for therapy if that's needed for a clinician and giving our clinicians access to therapy. I think that's an important component to not only addressing the antecedents to that moral injury and to burnout, but also addressing wellness. I know there's been a big push recently by the Dr. Lorna Breen Foundation and some of the work that has been done in Congress to try to help address clinician wellness and burnout, because we have to make sure that those that are taking care of us are also taken care of as well. Otherwise, they won't be there to take care of us. And so I'm so glad, Tashana, you brought this up, because that's one of the important stories here of how Omicron is affecting our healthcare system.
Yeah, you guys are seeing, I mean, this is all new to everyone, but you're seeing this day after day. Hospitals, patients, folks dying, and it's just been on a repeat cycle as we move into another year of this pandemic. Right. Dr. Brown, let's talk about kids now, kids in crisis, right? Cases are surging among them, but it's not just the virus that's impacting them. Tell us more about that.
That's right. So what we've seen is that there's more kids that are seeking emergency treatment in our hospitals for psychiatric conditions. And some of that can be traced back to a lack of social connection during some of the parts of the virus where we had our schools closed. On previous times that I've spoken with you and your team here, I've spoken about the importance of making sure that our kids are in school if we can assure levels of safety for their own health while they're in the school. But keeping them out, keeping them away from some of those connections that they typically can have do have harm. And so in a lot of our emergency departments, we're seeing an increase in the number of pediatric cases that require psychiatric hospitalization. So that's an area that has often been forgotten as we've been talking about COVID affecting kids. There are a lot of indirect things that do affect our kids and even adults during this pandemic.
Yeah, difficult time. Dr. Brown, as always, it is a pleasure. Thanks for stopping by again to chat with me.